After graduating from medical college in Pakistan, Dr. Azim Khan completed a residency training at Cook County Hospital in Chicago, which is the busiest public hospital in the United States. Most of the top-notch doctors in the United States have been trained there. He trained at Northwestern University Hospital in Chicago, where he did his wound healing fellowship with world-renowned dermatologist David Woodley. Northwestern University is one of the best universities in the United States. Dr. Khan trained with world-renowned wound healing specialist Dr. Richard Clark and received training in dermatology at State University of New York at Stony Brook, becoming an assistant professor in dermatology. He is still working in that capacity and delivers lectures to students and young doctors a few times every year. Dr. Khan also trained with two very famous cosmetic surgeons, Dr. Bisaccia and Dr. Scarborough. All of the doctors that he has trained with are authors of textbooks. And Dr. Khan himself is editing a textbook of wound healing with Dr. Richard Clark, ex-chairman and director of tissue engineering at Stony Brook University Hospital and Medical Center. Dr. Khan is the first American-trained, board-certified dermatologist and cosmetic surgeon in all of South Asia. Dr. Khan, I understand that you actually invented the technique of micro-liposuction. Can you tell me a little bit about that?
The micro-liposuction is just like routine liposuction, but we use very fine cannulas, and you can suck the fat from your chin, from your jowls very effectively. Similarly, you can actually inject the fat that you have taken from other parts of the body where it is not needed, and you can inject it where it is needed. So if it's not needed in the lower abdomen, on the lateral hips, where you don't like it to be there, you can actually suck it out from there and essentially inject it in these folds, or in the marionette lines that we call it, on the lateral folds around the chin. You can plump up some of the cheekbones. People who have very sunken cheek, you can plump them up, and you can actually make them much smoother. The technique was invented by our group. And there is another technique actually in liposuction that I wanted to tell you about, is the tumescence liposuction. Essentially, all the liposuction is being done under tumescence anesthesia, which means that we inject a lot of local anesthesia in the area where we are going to do the liposuction, and in that way we can actually constrict the blood vessels so that there is no blood loss during this technique. That was the main reason of mortalities in the old days.
Dr. Khan, tell me about your qualifications in cosmetic surgery and dermatology.
After graduating from Allama Iqbal Medical College in Lahore, I came to the United States and did a residency in internal medicine at Cook County Hospital, Chicago. Became board certified in internal medicine. Then I did a fellowship training in wound healing at Northwestern University Medical Center and Hospital, after which I did a dermatology residency at State University of New York at Stony Brook. I also performed a fellowship over there in wound healing with Dr. Richard Clark, and then I became a faculty over there. I became assistant professor in dermatology, which I am as of today as well. I still teach there. After that, I actually did a fellowship in cosmetic surgery with Dr. Emil Bisaccia and Dr. Dwight Scarborough. Dr. Emil Bisaccia is a professor of dermatology at Columbia University Hospital and Medical Center. I am board certified in internal medicine, board certified in dermatology, and I have performed a cosmetic surgery fellowship, which is approved by American Academy of Cosmetic Surgery.
Well, Dr. Khan is a very accomplished clinician, clinical scientist, and surgeon, and I suppose the most significant thing I could say about his clinical care is that I would be most happy to be under his care, and I would be most happy for my family to be under his care.
Dr. Khan is one of our very accomplished graduates. He's done his additional year of derm surgery, cosmetic dermatology training. Prior to that, he spent many years working with research in this department with Dr. Clark. He has boards in medicine and dermatology in the United States. which is more accomplished than I am. I only have boards in dermatology and dermatoimmunology. So he is a very accomplished physician with a very extensive training both in medicine, dermatology, and dermatologic surgery, including cosmetic dermatology.
Tell me a little bit about Cosmetique in Lahore, Pakistan.
I always had the dream of creating a state-of-the-art center of dermatology as well as cosmetic surgery in Lahore, where I came from. So to pursue that dream, after staying in the United States for about 15 years, we have been able to create such a center in which we have tried our best to pick every single thing from a needle to a laser, and we have paid attention to the finest details, that they are the state of the art and they are the finest, not only in Pakistan but also you can compare them with any standard, international standard. By any international standard, they are the best as far as the equipment goes. So it's the state of the art, I would say ultra modern, best equipped facility, not only in Pakistan but also in the whole South Asia or Asian region. I can almost say that without any doubt. Also, the staff is being trained and picked by me, and I have paid attention to the greatest detail that they do the things right and at a standard which I am used to in the United States.